Hello everyone. Today we're tackling a common but often hush-hush topic, hemorrhoids or piles. Hemorrhoids are swollen veins in your lower rectum and anus. Think of them as the body's natural cushions for stool control. Problems arise when these veins become enlarged, often due to increased pressure from straining, constipation, sitting too long, or pregnancy. Symptoms? The most common is bright red blood after a bowel movement. You might also notice itching, discomfort, or a lump near your anus. While these symptoms are usually harmless, don't ignore rectal bleeding. Always check with your doctor to rule out anything serious. Hemorrhoids are extremely common and nothing to be embarrassed about. Understanding the causes, like straining, chronic diarrhea, or pregnancy, can help you prevent them. If you notice symptoms, seek advice early. Your doctor can confirm the diagnosis and guide you to the right treatment. Remember, millions deal with this, and doctors talk about it every day. Don't let embarrassment stop you from getting help. Let's break the stigma and get informed. Doctors classify internal hemorrhoids into 4 grades, from mild to severe. Grade 1, small, inside the rectum, usually painless, maybe just a bit of bleeding. Grade 2, larger, may pop out during a bowel movement but slip back in on their own. You might feel a lump or some itching. Grade 3, prolapse during bowel movements and need to be pushed back in manually. More discomfort, possible mucus discharge. Grade 4, permanently outside the anus, can't be pushed back in, often painful and at risk of clotting. The higher the grade, the more likely you'll need medical intervention. Recognizing your symptoms helps you and your doctor choose the right treatment. Early grades are easier to manage. Advanced grades may need more than just creams. Don't wait for things to get worse. Address symptoms early. Understanding these grades makes conversations with your doctor clearer. The right diagnosis leads to the best care. Let's look at your treatment options. Treating hemorrhoids depends on their grade and your symptoms. For mild cases, start with lifestyle changes. Eat more fiber, drink water, and avoid straining. Over-the-counter creams and suppositories can soothe itching and discomfort, but use them as directed and not for long periods. If symptoms persist, minimally invasive clinic procedures are available. Rubber band ligation is the most common, quick, effective, and done without surgery. Other options include sclerotherapy, injecting a solution to shrink the hemorrhoid, and infrared coagulation, using heat to cut off blood supply. Severe or persistent hemorrhoids may require surgery, like haemorrhoidectomy or artery ligation. Your specialist will help you weigh the benefits and recovery time. Most people find relief with simple measures, but don't hesitate to seek help if symptoms continue. There's a solution for every stage. Next, let's take a closer look at rubber band ligation. Rubber band ligation is a top choice for treating grade 2 and 3 internal hemorrhoids. It's a quick outpatient procedure, no hospital stay needed. The doctor uses a small tube to view the hemorrhoid, then places a tight rubber band around its base. This cuts off blood flow, causing the hemorrhoid to shrink and fall off within days. You might feel some pressure or a dull ache, but it's usually well tolerated. Most people return to normal activities right after the procedure. Mild discomfort or a sense of fullness is common for a day or two. Simple painkillers help. Some bleeding may occur about a week later when the hemorrhoid falls off. Multiple hemorrhoids may require more than one session. It's a simple, effective fix with minimal downtime. For many, it's all that's needed to get back to normal. When non-surgical treatments fail, surgery, haemorrhoidectomy, may be necessary, especially for large or persistent grade 3 and 4 hemorrhoids. This procedure removes the hemorrhoid tissue entirely, offering a permanent solution. It's done under anesthesia in a hospital, usually as a day case or overnight stay. Recovery can be tough, with pain and discomfort, especially during the first week. Painkillers, stool softeners, and plenty of fluids are essential for healing. Warm sitz baths can soothe the area and keep it clean. Full recovery takes 2 to 6 weeks, so follow your doctor's aftercare advice closely. Avoid heavy lifting and stick to a high-fiber diet to prevent recurrence. Most patients report a huge improvement in quality of life after healing. Surgery is a last resort, but it's highly effective for severe cases. Don't let fear of surgery stop you from seeking relief if you need it.